preparation for Mo's surgery has become an unwelcome routine for Julie Brenizer. Since being diagnosed with Gorlin syndrome at 12 years old, she's had between 80 to 100 skin cancer removal procedures. Gorlin syndrome affects approximately 1 in 31,000 people. It's a rare disease that brings with it a higher risk of basal cell carcinoma and other tumours.
It's a process that I've grown to dread over the years because of the uncertainty. You don't know how long it's going to take. You don't know what the type of closure is going to be. I'm not a fan of people reacting and feeling sorry for me, because this is my life. This is a part of my life, and this is just the way it is.
Brenizer recently had another Mo surgery, but she says she needs such procedures far less frequently since she started taking medication. But the side effects include muscle cramps, hair loss, and problems with digestion. She says she's holding out hope for a potential future treatment that could help prevent basal cells from growing without the considerable side effects of the medication she's now taking.
Imagine being a young adult thinking this is how you've got to go through your life. Surgery after surgery after surgery, scar after scar after scar. To be able to say, I don't have to worry about that anymore.
Pharma is working with patients like Brenizer to get a better understanding of the disease and the treatment plan that's needed.
It is very important to have the patient associated to all our programs. There is nobody else than a patient who truly understands what it is living every day with the condition. And that's exactly why we want them to be associated with us in all the key steps of our clinical development programs.
Pharma dates back to 1908 and has more than 60 years of dermatological experience. Nothing about you without you is a key message for Pharma. The organisation has made a commitment that patients will be involved in the decision-making process. Pharma has now been working in partnership with the Gorlin Syndrome Alliance for around 2.5 years to better understand this rare disease.
Even the best medicine in the world cannot just do the trick by itself. There's a big psychological impact related to any chronic condition, and no molecule can take that like magically away. Patient organizations play a crucial role. I know that very much from oncology myself, so I know definitely this is also the case in this condition.
Through this partnership, a global survey has been conducted to provide further insight into Gorlin syndrome and the impact it has on people. Julie Brenizer says the relationship with Pharma is mutually beneficial and hopes to see similar levels of cooperation replicated across the wider pharmaceutical landscape.